Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
A multigravida client is admitted at 16 weeks gestation with a diagnosis of hyperemesis gravidarum. The nurse should explain to the client that hyperemesis gravidarum is thought to be related to high levels of which of the following hormones? 1. Progesterone. 2. Estrogen. 3. Somatotropin. 4. Aldosterone. The correct answer is 2. Although the cause of hyperemesis is still unclear, it is thought to be related to high estrogen and human chorionic gonadotropin levels or to trophoblastic activity or gonadotropin production. Hyperemesis is also associated with infectious conditions such as hepatitis or encephalitis, intestinal obstruction, peptic ulcer, and hydatidiform mole. Progesterone is a relaxant used during pregnancy and would not stimulate vomiting. Somatotropin is a growth hormone used in children. Aldosterone is a male hormone. A client at 15 weeks gestation is admitted with dark brown vaginal bleeding and continuous nausea and vomiting. Her blood pressure is 142/98 and fundal height is 19 centimeters. The nurse should prepare to do which of the following? 1. Transfer the client to the antenatal unit. 2. Keep the client NPO for 24 hours. 3. Administer magnesium sulfate. 4. Obtain an ultrasound. The correct answer is 4. The nurse should prepare the client for an ultrasound to determine the cause of the symptoms. Elevated blood pressure at this point in the pregnancy could indicate chronic hypertension, as well as hydatidiform mole. The fundal height of 19 centimeters is higher than is typically found at 15 weeks gestation and is indicative of a molar pregnancy. The dark brown vaginal bleeding in isolation could indicate an abortion, but when placed in context of the other symptoms, is likely related to a hydatidiform mole. The continuous nausea and vomiting is abnormal at this point in the pregnancy and can be a result of high levels of progesterone from a molar pregnancy. There is no fetus involved. The blood pressure elevation and continuous nausea and vomiting will resolve with evacuation of the mole, negating the need for magnesium sulfate therapy and placing the client on NPO status. After dilation and curettage to evacuate a molar pregnancy, assessing the client for signs and symptoms of which of the following will be most important? 1. Urinary tract infection. 2. Hemorrhage. 3. Abdominal distension. 4. Chorioamnionitis. The correct answer is 2. After dilation and curettage to evacuate a molar pregnancy, the nurse should assess the client's vital signs and monitor for signs of hemorrhage, because the surgical procedure may have traumatized the uterine lining, leading to hemorrhage. Urinary tract infections, not common after evacuation of a molar pregnancy, are most commonly related to urinary catheterization. Typically, urinary catheters are not used during evacuation of a molar pregnancy. The client should not experience abdominal distension because the contents of the uterus have been removed. Chorioamnionitis is an inflammation of the amniotic fluid membranes. With complete mole, no embryonic or fetal tissue or membranes are present. After suction and evacuation of a complete hydatidiform mole, the 28-year-old multigravida client asks the nurse when she can become pregnant again. The nurse would advise the client not to become pregnant again for at least which of the following time spans? 1. 6 months. 2. 12 months. 3. 18 months. 4. 24 months. The correct answer is 2. A client who has experienced a molar pregnancy is at risk for development of choriocarcinoma and requires close monitoring of human chorionic gonadotropin levels. Pregnancy would interfere with monitoring these levels. High HCG titers are common for up to 7 weeks after the evacuation of the mole, but then these levels gradually begin to decline. Clients should have a pelvic examination and a blood test for HCG titers every month for 6 months, and then every 2 months for 1 year. Gradually declining HCG levels suggest no complications. Increasing levels are indicative of a malignancy and should be treated with methotrexate. If after 1 year the HCG levels are negative, the client is theoretically free of the risk of a malignancy developing and could plan another pregnancy. The nurse notices that a client who has just given birth is short of breath ashen in color, and begins to cough. She becomes limp on the birthing table. At last assessment half hour ago, her temperature was 98 degrees Fahrenheit, pulse 78 beats per minute, respiration 16 breaths per minute. Determine the nursing actions in the order they should occur. 1. Open airway using head, tilt, chin, lift. 2. Ask staff to activate emergency response system. 3. Establish unresponsiveness. 4. Give 2 breaths. 5. Begin compressions. The correct order is 3, 2, 5, 1, and 4. The client's actions indicate distress, and the nurse should initiate emergency procedures. The nurse should first establish unresponsiveness and then ask staff to activate the emergency response system. Next, the nurse should follow CABs of CPR. The nurse should check the pulse and begin CPR. Then after 30 compressions, the nurse should assure the open airway and give 2 breaths. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first: 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on cord, enabling perfusion to the infant. Turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. A woman who has given birth to a healthy neonate is being discharged. As part of discharge teaching, the nurse should instruct the client to observe vaginal discharge for a postpartum hemorrhage and notify the healthcare provider about: 1. Bleeding that becomes lighter each day. 2. Clots the size of golf balls. 3. Saturating a pad in an hour. 4. Lochia that lasts longer than 1 week. The correct answer is 3. A postpartum client who saturates a pad in an hour or less at any time in the postpartum period is considered to be hemorrhaging. As the normal postpartum client heals, bleeding changes from red to pink to off-white. It also decreases in amount each day. Passing blood clots the size of a fist or larger is a reportable problem. Lochia varies in how long it lasts and is considered normal up to 6 weeks postpartum. A client at 4 weeks postpartum tells a nurse that she can't cope any longer and is overwhelmed by her newborn. The baby has old formula on her clothes and under her neck. The mother does not remember when she last bathed the baby and states she does not want to care for the infant. The nurse should encourage the client and her husband to call their healthcare provider because the mother should be evaluated further for: 1. Postpartum blues. 2. Postpartum depression. 3. Poor bonding. 4. Anger management. The correct answer is 2. The client is experiencing and verbalizing signs of postpartum depression, which usually appears at about 4 weeks postpartum, but can occur at any time within the first year after birth. It is more severe and lasts longer than postpartum blues, also called baby blues. Baby blues are the mildest form of depression and are seen in the later part of the first week after birth. Symptoms usually disappear shortly. Depression may last several years and is disabling to the woman. Poor bonding may be seen at any time, but commonly becomes evident as the mother begins interacting with the infant shortly after birth. Several pregnant clients are waiting to be seen in the triage area of the obstetrical unit. Which client should the nurse see first? 1. A client at 13 weeks gestation experiencing nausea and vomiting 3 times a day with +1 ketones in her urine. 2. A client at 37 weeks gestation who is an insulin-dependent diabetic and experiencing 3 to 4 fetal movements per day. 3. A client at 32 weeks gestation who has preeclampsia and +3 proteinuria who is returning for evaluation of epigastric pain. For a client at 17 weeks gestation who is not feeling fetal movement at this point in her pregnancy. The correct answer is 3. A preeclamptic client with +3 proteinuria and epigastric pain is at risk for seizing, which would jeopardize the mother and the fetus. Thus, this client would be the highest priority. The client at 13 weeks gestation with nausea and vomiting is a concern because the presence of ketones indicates that her body does not have glucose to break down. However, this situation is a lower priority than the preeclamptic client or the insulin-dependent diabetic. The insulin-dependent diabetic is a high priority. However, fetal movement indicates that the fetus is alive but may be ill. As few as 4 fetal movements in 12 hours can be considered normal. The client may need additional testing to further evaluate fetal well-being. The client who is at 17 weeks gestation may be too early in her pregnancy to experience fetal movement and would be the last person to be seen. A client with pregnancy-induced hypertension is to receive magnesium sulfate to run at 3 grams per hour with normal saline to maintain the total IV rate at 125 milliliters per hour. The nurse giving end of shift report stated that the client's blood pressures have been elevated during the night. The oncoming nurse checked the client and found magnesium sulfate running at 2 grams per hour. Identify the nursing actions to be taken from first to last. 1. Notify the primary healthcare provider of the incident. 2. Assess the client's current status. 3. Correct the IV rates. 4. Initiate an incident report. The correct answer order is 3, 2, 1, and 4. The nurse should first change the IV magnesium sulfate and normal saline infusion rates, and then assess the current status of the client. The nurse should then notify the primary healthcare provider to explain the error and report the action taken. A medication error has occurred, and the nurse will need to initiate an incident report. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which of the following. 1. Apathy, affect, social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. A client with schizophrenia comes to the outpatient mental health clinic 5 days after being discharged from the hospital. The client was given a 1-week supply of clozapine. The client tells a nurse that she has too much saliva and frequently needs to spit. The nurse interprets the client's statement as indicating which of the following? 1. Delusion, requiring further assessment. 2. Unusual reaction to clozapine. 3. Expected adverse effect of clozapine. 4. Unresolved symptom of schizophrenia. The correct answer is 3. Sialorrhea, excessive salivation, is commonly associated with clozapine therapy. The client can use a washcloth to wipe the saliva instead of spitting. It is an expected adverse effect of the drug, not a delusion, an unusual reaction, or an unresolved symptom of schizophrenia. The nurse hands a medication cup to a client who is psychotic and exhibiting concrete thinking, and tells the client to take his medicine. The client takes the cup, holds it in hand, and stares at it. Which of the following should the nurse do next? 1. Tell the client to put the medicine in the mouth and swallow it with some water. 2. Instruct the client to sit in the day room and wait for the nurse to assist him. 3. Ask another staff member to stay with the client until the client takes the medication. 4. Say nothing and wait for client to put the medication in the mouth and swallow it. The correct answer is 1. The nurse instructs the client clearly and directly to put the medication in the mouth and then to swallow it with some water. Clear, step-by-step directions assist the client to process what the nurse is saying. Telling the client to sit in the day room and wait. Asking another staff member to stay with the client, or saying nothing is not helpful. A client with undifferentiated schizophrenia tells the nurse that he doesn't go out much because he doesn't have anywhere to go and he doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? 1. Encouraging him to call his family, to visit more often. 2. Making an appointment for the client to see the nurse daily for 2 weeks. 3. Thinking about the need for rehospitalization for the client. 4. Arranging for the client to attend day treatment at the clinic. The correct answer is 4. Because the client can live in an apartment setting, further development of independent functioning, and the skills to gain as much independence as he is capable of need to be fostered, including getting out and developing new friendships. Arranging for participation in day treatment is most beneficial at this time. Family visits and daily nursing visits do not encourage the client to do this. Making an appointment for 2 weeks later puts the client's needs off. Lack of social relationships is not a sufficient reason for rehospitalization. A client diagnosed with undifferentiated schizophrenia is being discharged on aripiprazole 5 milligrams every night. When developing the teaching plan about the most common adverse effects, which of the following should the nurse include? Select all that apply. 1. Headaches that will subside in a few weeks. 2. Transient mild anxiety. 3. Insomnia. 4. Torticollis. 5. Pill rolling movements. The correct answers are 1, 2, and 3. Headaches, transient anxiety, and insomnia are the most common adverse effects of aripiprazole. Torticollis and pill rolling are more common with the older antipsychotics. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening. The nurse notes that a client sitting in a chair has not gotten up in 1 hour. The client does not respond to verbal directions, and her arm has been extended over the armrest for 30 minutes. Which of the following should the nurse do next? 1. Assist the client out of the chair to lead her back to bed. 2. Give PRN prescribed doses of haloperidol, Haldol, and lorazepam. 3. Ask the client to describe what she is experiencing right now. 4. Sit quietly with the client until she begins to respond. The correct answer is 2. The client is exhibiting catatonic behavior, an acutely serious result of severe anxiety and psychosis. In this situation, the nurse needs to administer the PRN prescribed doses of haloperidol and lorazepam. They can be given together safely. Assisting the client out of the chair go back to bed, or sitting quietly until the client responds ignores the seriousness of the client's condition. It is unlikely that the client can describe what is being experienced. For the client with catatonic behaviors, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? 1. The client can move all extremities occasionally. 2. The client walks with the nurse to the client's room. 3. The client responds to verbal directions to eat. 4. The client initiates simple activities without directions. The correct answer is 4. Although all the actions indicate improvement, The ability to initiate simple activities without directions indicates the most improvement in the catatonic behaviors. Moving all extremities occasionally, walking with the nurse to the client's room, and responding to verbal directions to eat represent single steps toward the client initiating her own actions. During a home visit, the nurse discovers that the client is less verbal, less active, less responsive to directions, severely anxious, and more stuporous. The nurse interprets these findings to indicate that the client needs which of the following? 1. A sleep aid. 2. A clinic appointment. 3. An increase in medication. 4. Immediate medical evaluation. The correct answer is 4. The client is exhibiting symptoms of becoming catatonic and unable to care for himself, and needs immediate evaluation and possible hospitalization. A sleep aid is not sufficient to treat this client. The client's worsening condition dictates action without waiting for a clinic appointment. An increase in medication may be indicated, but hospitalization is required first for safety. A 22-year-old client is being admitted with a diagnosis of brief psychotic disorder. 2 weeks ago, his girlfriend broke off their engagement and canceled the wedding. Given the Diagnostic and Statistical Manual of Mental Disorders, criteria for this disorder, the nurse should expect to find which data during the interview with the client? 1. Current treatment for pneumonia. 2. Regular use of alcohol or marijuana. 3. Evidence of delusions or hallucinations. 4. A history of chronic depression. The correct answer is 3. According to the criteria of the Diagnostic and Statistical Manual of Mental Disorders, a diagnosis of brief psychotic disorder is made when the client exhibits delusions, hallucinations, and disorganized speech or behaviors in the absence of a mood disorder, substance-induced disorder, or general medical condition. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population? 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care, is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities. A nurse working at an outpatient mental health center, primarily with chronically mentally ill clients, receives a telephone call from a mother of a client who lives at home. The mother reports that the client has not been taking her medication and now is refusing to go to the sheltered workshop where she has worked for the past year. What should the nurse do first? 1. Call the director of the workshop for information about the client. 2. Reserve an inpatient bed in preparation for the client's admission. 3. Ask to speak to the client directly on the phone. 4. Make an appointment for the client to see the doctor. The correct answer is 3. The first thing that the nurse should do is to speak with the client on the phone and question her about perceptions or reasons that are interfering with her going to the sheltered workshop. This conveys that the nurse is interested and willing to help the client. The nurse should call the director of the workshop for information only if the nurse receives the client's permission. Making preparations for the client's admission is inappropriate and would not be done until the client's needs have been assessed and it is determined that the client requires hospitalization. Making an appointment with the doctor is inappropriate until the nurse has assessed the client's needs. The director of a workshop program tells the nurse that the client with schizophrenia had done well for 6 months until last week when a new person started at the workshop. This new person worked faster than the client did and took his place as leader of the group. Based on this information, which of the following interventions is most appropriate? 1. Make a home visit and tell the client that if he does not return to the workshop, he will lose his place there. 2. Ask the director to assign the client to another work group when he returns to the workshop. 3. Make an appointment to meet the client at the mental health center and ask him about the situation. 4. Arrange the placement of the client in a skill training program. The correct answer is 3. The most therapeutic action at this time is for the nurse to make an appointment with the client at the mental health center to explore his feelings and behavior. Doing so acknowledges the client's importance and makes him a partner in resolving the problem. The nurse needs to determine what is going on in the situation first, and then plan accordingly. Threatening the client with loss of position, asking for a new assignment for the client, or arranging for the placement of the client in a skill training program is inappropriate and premature. A 23-year-old client diagnosed with schizophrenia cheerfully announces, "My mom and I are so excited that I'm pregnant. She's willing to help us take care of the baby too." Which of the following reasons should cause the nurse to be concerned about this situation? 1. The client did not say that the father of the baby was excited about this. 2. The mother is not likely to provide enough help for what the client needs. 3. Symptom management will be difficult in early pregnancy without medications. 4. The client will have difficulty financially supporting the baby. The correct answer is 3. Because antipsychotic agents cross the placental barrier and can be teratogenic, they are to be avoided during pregnancy, especially during the first trimester. Later in the pregnancy, low doses of medications may be given if necessary. Although the degree of excitement by the father, the mother's ability to provide help, and the client's financial situation may or may not be a concern. The priority in this situation is the safety of the fetus and risks associated with the need for antipsychotic therapy. A client is being discharged before complete stabilization of symptoms. When developing a discharge plan for this client, the nurse should ensure that the client will have 1. More medical consultations after discharge. 2. Monthly outpatient visits. 3. Many coordinated services. 4. A caring and supportive family. The correct answer is 3. Many coordinated services are needed, including medication management, more frequent outpatient visits, day treatment, or some combination of these, to decrease the risk of relapse, which is common among chronically ill clients. Medical consultations, if needed, would be included in the coordinated services provided. Chronically mentally ill clients who are discharged early before becoming truly stable typically require more than monthly outpatient visits because of the high risk of relapse. A caring and supportive family is ideal for all clients, but not always available.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.